Okay, so the topic for today's lecture is the antiemetic agents. Um, and what we mean by antiemetic agents are drugs used to treat or to prevent nausea and vomiting. And nausea and vomiting can be a very common problem uh, in your general medical practice. But unfortunately, the frequency of nausea and vomiting that happens is usually for each patient is not very frequent. Usually, a patient can suffer one or two attacks or episodes of nausea and vomiting, unless the patient is under chemotherapy treatment or anti-cancer drugs. These drugs can significantly affect the patient, especially at the level of the CTZ, the chemoreceptor trigger zone, which is a triggering part of to the vomiting center to start or to contract the muscles of the abdomen and the diaphragm to end up with vomiting. So, the learning objectives for this lecture topic, will be to study the receptors that are involved from the pharmacological point of view, uh, the receptors involved in the mechanism of nausea and vomiting, how to prevent the preventive measures or specifically the drugs that are used for the prevention of chemotherapy-induced nausea and vomiting, including the anticipatory nausea and vomiting, and we will come later to explain what we mean by anticipatory nausea and vomiting. Uh, Less common causes of nausea and vomiting are motion sickness and morning sickness, and the treatment can be a little bit different. For morning sickness, which happens during pregnancy, they call it morning sickness, the nausea and vomiting, which needs some kind of drugs that really cannot be harmful to the fetus, to the growing fetus and the growing embryo. So we use the least teratogenic agents. And for motion sickness, we need special uh, drugs or medications that are used to stop um, or to block the receptors at the level of the vestibular nucleus, which is part of the labyrinth system of the ear. Uh, that is the main reason for motion sickness. Motion sickness is the nausea and vomiting that happens with people who are traveling for long distances. That's why they have hypersensitivity of their the middle ear or the labyrinth system, including the vestibular nucleus, hyperstimulation of their receptors. This will lead to eventually stimulation or triggering the vomiting center to contract, cause nausea and vomiting, and leading up in motion sickness, ending up with motion sickness. So, as a brief introduction, because we are mainly focusing on the recurrent nausea and vomiting, which is mainly related to the side effect of anti-cancer drugs or chemotherapy-induced emesis, vomiting. You can see that about 70 to 80% of all patients who are taking chemotherapy, anti-cancer agents will suffer from nausea or vomiting, or both of them. Some less common cases of nausea and vomiting, which includes morning sickness, pregnancy, hepatitis, infections. But it is nausea and vomiting that is produced by chemotherapy agents. Those are really the agents that we should focus on because they demand effective management, and we need sometimes combination of antiemetic agents to stop the nausea and vomiting, so that we prevent the patient from stopping the anti-cancer treatment. You know, one of the challenges for anti-cancer treatment is that um, the disturbing side effects, the dreadful side effects for the patients, sometimes ending the patient with the choice or with the decision of leaving chemotherapy just to avoid the side effects. So that's why it's very important to treat nausea and vomiting as one of the distressing side effects of anti-cancer drugs, so that we help the patient not to stop or not to withdraw from the management of cancer because of this distressing side effect. Uh, other important um, Other important goals for the treatment is to prevent the complications of nausea and vomiting. You know, nausea and vomiting can lead to which kind of metabolic disturbance? Does it lead to a metabolic acidosis or alkalosis? Pavi, are you there?
Yeah.
What do you think? What do you think? It does cause metabolic acidosis or alkalosis if the patient is having recurrent nausea and vomiting as a result of uh, recurrent use of chemotherapy for cancer or anti-cancer drugs.
Sorry, Prof. Again, please. Were you asking what is the reason of acidosis and alkalosis in
Wait,
chemotherapy
no,
drugs?
I'm saying I'm asking which one is the metabolic disturbance that happens as a result of nausea and vomiting? Which metabolic disturbance? Is it metabolic acidosis or alkalosis?
I think it's acidosis, Prof.
Metabolic acidosis. Uh, I think the correct answer is metabolic alkalosis because
Yes.
because when the patient is having recurrent nausea and vomiting, then the HCl, the acid of the stomach, will be depleted, and this will lead to for the parietal cells to over synthesize or for the compensate for the HCl, and therefore the H proton will be consumed. The hydrogen proton will be consumed, leading to reduction in hydrogen proton in the blood and elevation of blood pH. Yep. So this will lead to metabolic alkalosis. Whenever you lose more acid as a result of nausea and vomiting, you know the content of the stomach is acidic. So in nausea and vomiting, you will lose acid in the form of HCl vomiting. Yeah. So expulsion of acid will lead to loss of acid and ending up the patient with a higher alkaline level, which means metabolic alkalosis. Is that clear, Pavi?
Yes, Prof. Thank
Okay, so in addition to metabolic alkalosis, the patient will end up with severe electrolyte depletion. Severe electrolyte depletion. Yeah. Uh, these are and dehydration because of loss of recurrent loss of fluids through the vomiting with the vomiting. So these are also metabolic problems, metabolic concerns of recurrent nausea and vomiting, other than having the patient withdrawing from the anti-cancer therapy. This makes necessary or makes it very important for us to not to treat and not to ignore the nausea and vomiting, especially during the chemotherapy treatment. Is there anybody from the participants still waiting there? I have to admit those participants. Mhm. Is there anybody waiting in the lobby?
Not sure, Prof.
Nobody, yeah? I cannot find anyone right now. Participants, everybody in. Okay, because we still have some 10 students that didn't join yet. We still have 51, only 51 participants so far. Ayman, please prepare the attendance sheet, please, for me. Okay, go back to the, okay, we go back to the lecture topic, and then 10 to 40% of patients will experience nausea and vomiting in anticipation, and this is called anticipatory nausea and vomiting, which means this nausea and vomiting has nothing to do with the chemotherapy being injected or reaching the CTZ. It is a kind of psychological reaction when of the patient to before receiving the chemotherapy, because the patient will be anticipating the result of the injection or the intake of those chemotherapy anti-cancer agents, leading to severe nausea and vomiting. So in expecting, while the patient is expecting to receive this drug, he will or she will suffer from this kind of nausea and vomiting. So it is more related to the memory rather than to the drug itself. So it's more related to the cerebral cortex effect on the vomiting center rather than the chemotherapy effect on the CTZ, the chemoreceptor trigger zone. So here the treatment should be different. If the patient is suffering from anticipatory nausea and vomiting, we should not treat with the same in the same manner or in the same way, same strategy as we do for the nausea and vomiting that happens after the injection. This happens before the injection or the intake of the drug. Yep. So we move to the next slide, and that's why it's important for us to understand the receptors, because when we understand the receptors we will be able to, sorry, when we understand the receptors, can you view the slide now? I'm sharing this slide for the receptors.
Yes, Prof.
Yeah, so here if you can see in this diagram, you can see in this diagram, can you see my pointer? I'm trying to point at the CTZ now.
Yes,
CTZ
yes, Prof.
at the center. Okay, great. Thank you, Mira. At the center, you can see the CTZ, chemoreceptor trigger zone, which is rich in dopamine D2 receptor and serotonin 5-HT3 receptors. 5-HT stands for 5-hydroxytryptamine. Yep, which is a synonym to serotonin. So 5-HT3 receptors and D2 receptors are rich in the CTZ, chemoreceptor trigger zone. The location of the CTZ is outside the blood-brain barrier, which means it can receive all uh, the endogenous toxins or the drugs or the chemicals that are present in the blood, and it can the receptors can really sense those toxins or drugs or chemicals. Yep. So this is the CTZ. This is the importance of the CTZ.